Hi, I'm Matt Hudson, author of The Saboteur Within, the definitive guide to overcoming self sabotage. And I'm going to chat to you now about migraines, yeah. Debilitating headaches. And they usually can start around 12, 13 years old, sometimes younger, and it can be a blinding, nauseating pain, a headache that you end up in a darkened room and you just cannot get your head off the bed. It's quite literally absolutely debilitating. Nauseous, just horrific. If this is you, I want to offer you a different viewpoint. Is it possible? Now, there's a lot of research gone into a thing called ACEs, adverse childhood experiences. Now, this doesn't mean you've been sexually abused when you were a child or attacked. It could mean something as simple as moving house, a new sibling arriving, just tiny little things. Oh, maybe a big thing that mum and dad got divorced. That's huge. But these emotions, they come along at this point in time. They can be stored in the mind's eye as emotional memory images. So what happens then? As we grow older, anything that remotely resembles this keeps appearing. Every time it appears, the stress response triggered by this hits the brain, and we end up with an injection of cortisol. So cortisol is a brilliant drug in a very short fix. If we're going to fight, cortisol is brilliant. You see boxers, punch, 15 rounds, all that cortisol, all that adrenaline. That's the body working as it should. However, when it's firing at an infrequent, unmeasurable, uncheckable time, but boof, there you are. You're laid out for 2 or 3 days in chronic mind head numbing pain. It could be that one of these emotional memory images is firing, and every time it fires, poof, your system goes that way. So what we're looking to do then in my work is help you to clear this screen so that the response doesn't happen again. It seems so simple, and yet it's very profound. A new way for a psychophysiological condition to be treated. Now, when I say psychophysiological, what I'm saying is the psyche, the mind, adjusting the mind to impact the body, the physiology. Now, it's fascinating how much more research is coming on board nowadays that shows that our thoughts really do influence our body.